Hey everyone, welcome to another episode of Rebelcast, your ultimate destination for translating medical research into clinical practice. I'm Marco Propersi, and thanks for tuning in. Don't forget to subscribe to the podcast and follow us on social media to stay updated with our latest content. Today we're exploring new treatments for supraventricular tachycardia. Specifically, we're looking at the combination of the modified Valsalva maneuver and intravenous adenosine for the treatment of paroxysmal SVT. At the time I'm recording this podcast, the post is already live, and perhaps by fate, luck, coincidence, or all of the above, this happened to me a few days ago. Sarah, a 34-year-old patient and mother of two, rushed into the ED last week while I was on shift. She clutched her chest and reported palpitations and dizziness. Her heart rate was racing at 180 beats per minute. Sarah had experienced rare episodes of SVT in the past, and she attempted the standard Valsalva maneuvers before coming in, but it didn't work. And like most patients with SVT, she was relatively stable, and her symptoms, though common, were causing increasing levels of anxiety. So I asked a nurse to prepare diltiazem, and I remembered this paper that I just covered on Rebel EM. Could we use the modified Valsalva maneuver here on this patient? So with her consent, we decided to give it a try. Traditionally, we relied on standard Valsalva maneuvers and intravenous adenosine as the primary treatment modalities. However, there's a recent Cochrane systematic review published in 2018, and they found that the cardioversion success rates between adenosine and diltiazem were essentially the same. In 2020, American Heart Association published guidelines for cardiopulmonary resuscitation and emergency cardiovascular care. They updated the treatment for supraventricular tachycardia and stated that there are no appreciable differences in the success or major adverse events between the use of calcium channel blockers or adenosine for the treatment of SVT. But today we're going to discuss this new study by Zhao and colleagues, which was published in the American Journal of Emergency Medicine in 2024. This study investigated whether combining modified Valsalva maneuver with intravenous adenosine could achieve better success rates in converting paroxysmal SVT to normal sinus rhythm compared to either treatment alone, and that's adenosine alone or modified Valsalva maneuver alone. This was a prospective study, randomized control, conducted across multiple centers, and patients with confirmed SVT were randomly assigned to one of three groups. That's modified Valsalva maneuver alone, IV adenosine alone, or a combination of both therapies. For the modified Valsalva maneuver group, patients exhaled into a syringe for 15 seconds and then were rapidly moved into the supine position with legs elevated. For the adenosine group, IV adenosine was administered in escalating doses of 6 milligrams, 12 milligrams, and 18 milligrams. And for the combination therapy group, patients started with the MVM protocol, and at the beginning of exhalation, IV adenosine was added. After 15 seconds, patients were repositioned to a supine position with legs elevated. Let's talk about the outcomes. Primary outcomes measured success rates of cardioversion on the first attempt, total success rate, and the average dose of adenosine required. Investigators also looked at some secondary outcomes, including the duration of antiarrhythmic effect and adverse effects. What they found, after they randomly assigned 122 patients into these three groups, was that the combination therapy had a significantly higher success rate on the first attempt of 50% compared to the modified Valsalva maneuver alone at 24% or the adenosine alone at 30%. The total success rate was also higher in the combination group at 86% compared to adenosine at 75% and modified Valsalva maneuver at 42%. The investigators found no statistically significant differences in any adverse effects and no major safety concerns. Let's go a little deeper into this paper. The paper is interesting and innovative, but it lacks crucial methodologic information. There are important details which are missing. How are the patients selected? What was the randomization process? The study is also unblinded. It would have been difficult to blind the modified Valsalva maneuver just by nature of the technique, but it does add more uncertainty when interpreting our data. Small sample size also raises concerns that any observed differences between these groups might simply be due to chance alone. The outcomes are also a bit curious. What's the relevance of first attempt success of cardioversion especially considering that additional attempts at adenosine, they occur simultaneously and they only slightly extend the time to cardioversion. The safety concerns regarding adenosine also appear to be overstated. Adenosine has a very favorable safety profile and it mostly has minor side effects. And most people listening to the podcast are familiar with this feeling of impending doom that patients experience as they convert to normal sinus rhythm. But these adverse effects are rapid and transient, and we rarely see serious effects associated with adenosine. The secondary outcomes are even more suspect. What is the clinical relevance of the disease-oriented secondary outcomes, such as the R to R interval and the heart rate 1 minute after cardioversion? And finally, it's unclear whether combining the modified Valsalva maneuver with adenosine would even reduce these side effects. Let's move on and talk a little bit about medications. The study reported unusually low success rates for adenosine. They reported 30% cardioversion for the 6 milligram dose and 60% for the 12 milligram dose. These rates are significantly lower than those found in existing research. Now, there's evidence to support a higher weight-based approach at 0.1 mg per kg, and there's even evidence to suggest that we should just start at 12 milligrams in certain populations. Let's talk about the maneuver. The REVERT Randomized Controlled Trial found that the modified Valsalva maneuver is superior to standard Valsalva maneuver for converting patients with paroxysmal SVT back to normal sinus rhythm. Using the modified Valsalva maneuver in parallel while establishing IV access or preparing medications, it seems safe and practical. But once medications are ready, this paper does not provide convincing evidence to support additional attempts with modified Valsalva maneuver. Let's take a break from evidence-based medicine and get back to Sarah. While we were waiting for medications, I tried the modified Valsalva maneuver 3 times without effect. The nurse came in with her weight-based dose of diltiazem, and after the administration, she converted back to normal sinus rhythm. She was relieved, and so were we. So what's the bottom line? While this study presents an innovative approach to treating paroxysmal SVT, the evidence is not yet strong enough to change clinical practice. Using modified Valsalva maneuver in parallel with preparing medication seems practical, but combining the technique with adenosine requires further validation. This study's results are largely clinically unusable. Thanks for tuning in to Rebelcast. For more insights and updates on the latest in emergency medicine, critical care, and other medical literature, subscribe to our podcast and follow us on social media. Stay curious, stay informed, and stay tuned for our next episode. Until next time, take care.